Hello, I'm Dr. Margaret Ames, and you're listening to Your Dental Health. The mission of my show is to get the word out about biomimetic dentistry. That's a major paradigm shift in dental care, and it's for you to experience more comfortable, less invasive, and beautiful dentistry. Biomimetic means mimics life. If 20th century dentistry had been so great, there would be no such thing as redoing a crown. There would be no such thing as root canal therapy. There would be no such thing as dental implants. This is my passion. Now, you don't have to have such amputational, aggressive treatment. Minimally invasive dentistry is here. You can reach me in my office at 631. Wait a minute. I'm not going to tell you. Because the mission of my show is to get the word out about biomimetic dentistry. So if you really want to know, search the internet. You can find out more about it that way, or you can listen to my show. So I'm in Huntington. I've been practicing there for over 20 years, and it's really exciting. I can't tell you what a great week this was. It was so much fun. I sit there and I couldn't be more joyful. I mean, I really found something that gives me such satisfaction working with wonderful people. I'm so grateful for the team of people that surround me every day. Our bosses are our patients. We answer to you. You pay our salaries. We're grateful for that, and we treat you with real respect. So look at my website, www.drames.com. That's DRAMES.com. And there are some really good, short, 1 to 3 minute informative videos that you can see there. So minimally invasive dentistry means not cutting away a lot of your tooth structure. Many products that we humans use are designed to fail predictably, in order to protect the users from costly damage or injury, from Mercedes-Benz's crumple zones designed into cars to protect occupants by absorbing the forces of the crash before it reaches the passenger compartment. Also, there's a simple bicycle helmet that absorbs the force of an impact and splits in order to direct the force away from the head. These designs exist for a reason: to fail before more extensive damage can occur. Procedures in dentistry have many ways of protecting teeth. When we look at a split tooth, patient with split tooth syndrome, it's horrible. They come in, something's wrong, and it's really hard to find fractures in teeth. X-rays don't show them. You have to wait until it gets, well, if it's symptomatic, if the patient has symptoms, you kind of have to wait until it shows up. And that can be a process of a few days. It's really kind of sad. So we don't want to have split teeth. It's a vertical fracture right up the tooth. So, in the past, in the 20th century, dentists have put a full cast coverage, an onlay or a crown to protect the tooth. But now there's such a high demand for beauty in dentistry. Nobody really wants to have that gold showing, even if it's on the back teeth. So there's some white crowns being done. There are many other options, but the ideal way is always to keep the fracture from propagating and keep the tooth comfortable for the patient. If the system is overloaded, for example, when you chew on a hard bagel or an unpopped popcorn kernel, these restorations keep the tooth from flexing, resulting in patient discomfort. So the thing that's supposed to keep cracks from propagating actually don't flex. So here comes minimally invasive dentistry. So we incorporate flexible components into the restoration. So when we look at a fractured tooth that has either lost a cusp, like a piece of it, people call up and they say, oh, I broke my tooth, I have to come in. And then historically, dentists will go, okay, you need a crown. And patients will say, okay, I realize I broke my tooth. I broke a quarter of my tooth out. Of course I need a crown. But actually, that's the old way. This is the way a lot of dentists are practicing right now, but it doesn't have to be. I can give you email me at drames@drames.com. I can give you sources of research that actually prove that this stuff, it's been around for 15 years that I specifically know of. I've been practicing this way for 5 years, and the number of root canals that have to be done is decreased by 90%. So we can use a more conservative approach than a full crown while protecting the tooth by some re-engineering of the system. Often, this type of tooth has been restored before. So, you have a silver filling. When you have a cavity between your teeth, the dentist has to drill away a lot of healthy tooth structure to get to it. So they cut the tooth in half, kind of. So you have an outside half and an inside half. Once a tooth has all the old restorative material removed, there's very little stuff left around of the tooth. The only good parts left are the outside that touches your cheek and the inside that touches your tongue. So to do a traditional crown, you cut away that part. Lots of times there's nothing left, nothing much left to crown. The tooth is a stump at the gum line. Okay, enter root canal. We have to put a post in there so you have something to put the crown onto. A post gets put, root canal has to be done electively. This is the old way. This is the way it's being done today. It doesn't have to be done this way. So, if in these cases, there are options that beyond an elective root canal with a post and a core, and then making a crown. If you just tuned in, you're listening to Dr. Margaret Ames. I'm speaking about your dental health. You can reach me in my Huntington office at 631. Nope, I'm not going to tell you tonight because you can look at my website and you can find my phone number there, but you can also learn a heck of a lot about not cutting away healthy tooth structure. So minimally invasive biomimetic dental restorations can be fabricated to absorb the forces of occlusion and protect the remainder of the tooth from catastrophic failure. A catastrophic failure is losing the tooth, or a root canal, or needing to have gum surgery because your tooth fractured below the gum line. Often we see teeth that fracture off the outside cusps of an upper molar or the inside cusps parts of a lower molar because of a large, old restoration that's plugged in like plugging a pothole. Minimally invasive dentistry is not like plugging a pothole. You actually rebuild layer by layer in small increments. One of my patients that was in this week gave me a good example when I was explaining it to her. She said, "Oh, it's like spackling or plaster. You have to put the spackle in the crack and you have to wait till it dries and sets and it shrinks. And then you add another layer and another layer until the spackle is flush with the outside surface." Fortunately, in dentistry, you don't have to wait a day for it to dry, but you do have to wait a very important couple of minutes. And some dentists that say they do biomimetic dentistry and they're rushing through it, it's not just the materials that you use, it's the way you use them and the time that you take to slow down, relax, make the patient comfortable, and let those parts of the tooth, the restoration or the composite resin, shrink, just like the spackle does. So classically, dentists are trained that if a tooth is really compromised and it needs a crown, is to restore the strength and the form and the function, and sometimes the appearance. The reality is that we can be more conservative, preserve much more of the natural tooth structure, and still protect it from future catastrophic failure. By simply removing the old restorative material, freshening up the surface to be bonded with air abrasion, we can then start to build the tooth back in a way that if it fails in the future, it'll fail with the same predictability of the minimally invasive products that we talked about before, to protect the patient from the more catastrophic failures and pain and suffering. We don't want that. You heard the sound of the drill on the show last week. I had a few complaints about that, so I don't know if I'm ever going to play that for you again. But simply restoring the tooth with a resin-bonded restoration and preserving all the flexible parts and making the restoration flexible can increase the strength of the tooth and protect it from most normal bite-loading forces. Research has shown that when excessive forces are applied, fracture and failure can occur. This is horrible. Dentists love to get that phone call because that means I'm going to get to do a crown. However, that doesn't have to be done. Whoops, there goes my producer. We don't want that. We want you to have less drilling, air abrasion. It's particularly good for the kids because you don't have to drill at all if you've never had a filling before in that tooth. So where was I before David introduced that sound? So using layers of energy-absorbing and stress-distributing fibers in the form of a fabric ribbon, which is closely adapted and bonded to the drilled tooth structure. There's a cleavage zone. It's created to allow any crack caused by any excessive biting forces. It doesn't allow them to progress. They can only progress as far as that piece of ribbon, and then they're dissipated. Once the force propagates to the ribbon, it will redirect, and the cracks will turn and move along the force of the ribbon to move it to the outside. The fracture that occurs is not catastrophic and is actually very repairable. This is what I do in my office. This is what I love. At the end of the day, when I go home, I just feel like I really made a difference. That patient's not going to have a root canal. They may break something. They may earthquake their tooth, but it's not going to happen that they're going to end up in pain. If something does break, it's going to break. It's going to fail in, what did I call that? A crumple zone. So I'm going to tell you that after the break about a cardiologist, which he doesn't specifically relate to dental, but we're going to talk about that. So stay tuned, and we'll be back in a few minutes. This is Dr. Margaret Ames, and you're listening to Your Dental Health.
When you give me that pretty little pout.